Waiting an official start, but I will start then. Thank you. Good morning, everyone. It really is a pleasure to be here today. And looking at the opening back in October, it really struck me that a building is just a building without the people. And so I understand some of you have been here for 17 years with the community health group, and I just want to give my commendation to all your good work. So I'm joined by my Ottawa area colleagues, Minister Lisa McLeod and MPP Jeremy Roberts, who is also a parliamentary assistant. These two people are amazing advocates for their community, for Ottawa, their constituents. And I want to welcome Minister Peter Bethlenfalvy, President of the Treasury Board and Minister of Finance, to Ottawa. This is not his first visit to Ottawa, but a little rainier than usual. So thank you for being here. So on Wednesday, you all know that Minister Bethlenfalvy presented our government's 2021 budget, which focuses on two vital priorities: protecting people's health and protecting our economy. And this budget has measures that protect the health of all Ontarians. And I want to underscore the historic investments it makes in long-term care. What happened in long-term care homes during this pandemic was decades in the making, after years of neglect and underfunding of this sector. And Budget 2021 is a major step forward for long-term care, with unprecedented investments. The previous government took nearly 10 years to build just 611 beds across this province, and that equates to about 1 bed per long-term care home. We are building 30,000. 30,000 safe, modern, comfortable spaces for our seniors to call home, and many of these spaces right here in Ottawa. And with this budget, Ontario is investing an additional $933 million for a total of $2.68 billion to make good on that commitment to build capacity and to repair and rebuild long-term care. We are investing $246 million to improve living conditions for residents in long-term care homes, including air conditioning. And this will ensure our loved ones live in comfort and with safety, dignity, and utmost respect. Last December, we committed to ensuring residents receive an average of 4 hours of direct care. So not only do we need to build the capacity that has been languishing for many years, but we need to address the staffing on an urgent basis. And this is an ambitious commitment that will make Ontario the leader in the country. To make this a reality, tens of thousands of new staff need to be hired to provide the care, and that can't happen overnight. And that's why Ontario is investing $4.9 billion over 4 years to increase the average direct care to 4 hours a day for our loved ones in long-term care. We will also hire more than 27,000 staff, including personal support workers and nurses. And we are continuing to act with a sense of urgency. We are investing over $120 million to support the accelerated training of almost 9,000 support workers. This is in addition to over 8,600 staff hired already through the pandemic pay earlier. These staffing efforts taken together result in more than 17,000 staff for long-term care by the fall of 2021. We know that PSWs are the backbone of long-term care and that they do vital work every day so that our loved ones receive the quality of care that they need and deserve. Last October, I was proud to launch the Community Paramedicine for Long-Term Care program. We started with 5 communities, including the City of Ottawa. This innovative program makes it easier for seniors to live in the homes that they love longer. It is where, for the most part, they want to be. And in this budget, we announced that we are investing $160 million in the Community Paramedicine program to bring care and services to the homes of seniors in 33 communities across the province. So there is no doubt that our government is repairing and rebuilding long-term care in Ontario like never before. We are spending more than $9.6 billion in response to the pandemic to shore up staffing and modernize our long-term care homes. This budget is wonderful news for Ontario, for Ottawa, and for the future of long-term care in our province. And I want to thank Minister Bethlenfalvy for his hard work on this budget. So welcome him to Ottawa and invite him to the podium.
Well, thank you, Merrilee. You've been an incredible leader in a very difficult time, and true leadership rises to the challenge, and you're doing that. And of course, Lisa, you're doing the same for one of the hardest hit sectors in the economy. Lisa McLeod has been truly a tireless advocate and champion for many of the hardest hit sectors in Ontario: tourism, sports, culture, heritage, the list goes on, and she is tireless. So thank you to both of my colleagues, and of course Parliamentary Assistant Jeremy Roberts and Cam. Great to be here in this fantastic facility. You know, it's been more than a year that Premier Ford made a clear, non-negotiable promise to the people of Ontario. Your government will do whatever it takes to protect you from this pandemic. Our frontline healthcare workers have sacrificed so much over the past year, and our government will continue to help keep them safe and support them in delivering the high quality of care that the people of Ontario need and deserve. Our budget was called Ontario's Action Plan, Protecting People's Health and Our Economy. And today I want to highlight the first pillar, protecting people's health. It is the foundation, because without healthy people, we cannot have a healthy economy. And it starts with hospitals, the place where people go when they are most in need of care. Making sure our hospitals and the healthcare system have the capacity they need to care for people during COVID-19 and beyond, that is part of that. Y compris s'assurer que les hôpitaux ont les travailleuses et travailleurs ainsi que l'espace dont ils ont besoin pour protéger la santé de la population pendant la pandémie de COVID-19 et après. When Ontario families face a health challenge, they need to be confident that they can get the care and treatment they require at any hospital throughout this province. That is why Ontario is making the necessary investments through the 2021 budget, Ontario's Action Plan, Protecting People's Health and Our Economy, to ensure hospitals can care for people when and where they need it. We have invested an additional $5.1 billion since the beginning of COVID-19. This has created more than 3,100 additional hospital beds, the equivalent of 6 new large community hospitals. It has made more resources available to clear the backlog of surgical procedures that the pandemic has created, and so that we can keep the operating rooms open late at night and deliver care in new, modern, bigger, and better hospitals. We are accelerating our long-standing work with a more than $30 billion to build, expand, and improve hospitals across the province over the next 10 years. This includes $5.1 million to support the expansion of the Carlington Community Health Centre, where we are today. This additional funding brings the province's total investment for the project to up to $9.9 million. Our 2021 budget also includes funding to build a new treatment centre for children in Ottawa as part of the Children's Hospital of Eastern Ontario. And thank you, Jeremy Roberts, for your advocacy, and all the members here in the Ottawa region. They care so much for children, and I'm so proud to be part of that. This funding will support the construction of a nearly 200,000 square foot facility, which will reduce the need for families to travel to multiple facilities to gain access to critical programs and services, such as developmental care, autism services, and occupational therapy. Our government will continue to make investments in the health care that the people of Ottawa need and deserve. both to get us through the pandemic and to build a high-quality health care system for generations to come. These announcements build on our record of investments over the last year, including purchasing additional supplies and equipment for hospitals for COVID-19 testing and critical investments to buy more PPE and supplies. But as I always say, you cannot have a healthy economy without healthy people. And that's why the 2021 budget, we continue to invest in Ontario's healthcare and long-term care systems for our urgent fight against COVID-19 and to strengthen it for future generations. Now, while we are not out of the woods yet, hope is on the way. Thank you to the doctors, the nurses, the staff and healthcare workers and the personal support workers across the province for protecting our health. And thank you for everyone for doing your part to keep Ontario safe. Thank you so much, and now I'll pass it over to Cameron MacLeod, CEO of Carlington Community Health Centre. Thank you.
Good morning, everyone. Bonjour. Thank you, Minister. Very pleased to welcome you all here this morning. My name is Cameron MacLeod. I'm the very proud Executive Director of the Carlington Community Health Centre. A special welcome to Ministers Bethlenfalvy and Fullerton, who have never been here before, and we hope to have them back. And a warm welcome back to Minister MacLeod and our own MPP, Jeremy Roberts. I'd also like to acknowledge our staff members who are with us here today and who have worked with the Minister's staff to pull this all together for us. Carlington has been in the midst of an extensive capital expansion and renovation project. The building in which you are standing is the result of a remarkable story. It started with a vision to create space where two critical needs could be met by leveraging the strengthened resources of two committed organizations. It's also the product of funding investments from all three levels of government. In partnership with Ottawa Community Housing Corporation, we've built a structure on Carlington's property that houses a new medical clinic, which quietly opened in October 2020, and 42 units of affordable housing for older adults under the same roof. It is a model of which both organizations are very proud and which we hope has broken ground for others to undertake similar ventures. The Ministry of Health's investment in our new clinic and in the ongoing renovation of our legacy building will offer opportunities for our community and our staff that are closely aligned with the government's quadruple aim ambitions. First, the expanded space will offer accessible and high-quality services to our clients and our community. It provides the tools and environment that allows our staff to feel supported, safe, and valued. Third, it provides excellent value for the investment. And lastly, it will contribute to the improvement of the overall health and well-being of the community we serve. And a fun fact, the building that you're standing in right now is built to Passive House standards. This is the world's the most energy-efficient construction model in the world, and will reduce the costs and cut carbon emissions to next to zero. I am actually told that the annual cost to heat one of the apartment units upstairs is $30. The past year has been challenging for everyone in Ontario and beyond. We've all worked hard to keep critical services accessible to the people who count on us. I've asked our staff at Carlington to work in a way that is vastly different than what they were used to in the days before the pandemic, and each person has answered the call. I'm especially proud of the work that the community health centres in Ottawa have responded to the pandemic call to action. With our partners on the Ontario Health Team at Keep Santé Ottawa, we've diverted our attention towards those who have been disproportionately impacted by COVID-19. The people who even before the global crisis were swimming against the currents of the social determinants of health. Ottawa has embraced the Ontario Health Team model, and we now have 3 approved teams in town that are committed to working together to ensure the best possible access to care for everyone in our city. I believe that we are in a time of accelerated evolution. We're now doing things in a way that we could not have imagined a short year ago. The virus did not allow us the luxury of taking the usual amount of time to worry about cost, rollout logistics, policies, or whether or not it was a good idea in the first place. We just ripped off the proverbial Band-Aid and learned as we went along. For Carlington and many others, there was an immediate and very successful shift to the use of virtual care. Since we began offering alternatives to in-person appointments in our clinic, we've seen our no-show rates plummet from 7% to 1%. It is safe to say that this type of access to care is here to stay. Another case in point, as the pandemic played out, we've all been concerned about the impact on people's mental health, and we've seen this drive innovation. One example of this is the creation of Counselling Connect here in Ottawa. In May 2020, during the disruption in mental health services and addiction services caused by the first lockdown, the Ottawa Health team at Keep Santé Ottawa supported the launch of a portal that allows people quick access to brief counselling from qualified therapists virtually using their computers or phones. Counselling Connect is sustained by over 100 therapists from over 25 organizations, and as of January 31st, 2021, 4,500 appointments had been delivered in multiple languages to numerous people from equity-seeking communities, including Francophones, Black African Caribbean, Indigenous, and LGBTQ+. This is but one example of how our community has leaned in and leveraged the technology and partnerships to mitigate the impacts of the pandemic. It also checks all the boxes for the quadruple aim. I look forward to nurturing these new approaches and working with government and our partners to close the gaps that COVID-19 has been so cruel in exposing. We all hope that we're seeing the light at the end of this tunnel. But even with the vaccines rolling out, we're not there yet. There's recovery work to do, and we will face this for literally years to come. For our at-risk communities, the support of community health centres and our partners has never been more important. At Carlington, we look forward to welcoming our neighbours back into our centre and celebrating the new possibilities offered by our new space. Thank you again, Ministers and MPP Roberts, for the opportunity to speak this morning and for your ongoing support of our programs and our people here at Carlington.
Thank you very much, Cam. Always great to be here. MPP Roberts, thank you for hosting us today. And to my two colleagues, we have sat, I think probably as a cabinet almost 190 times in the last year, which I believe is unprecedented, and you really get to know people when you spend that much time with them. And I would like to just pay homage and compliment my colleague from Canada Carleton, the Honourable Merrilee Fullerton, for her tremendous leadership and work during this past year. I've seen it firsthand, her determination and her dedication toward her sectors, and her care and comfort for the people in long-term care. I want to thank you. You don't get enough credit for all that you do. And to Minister Bethlenfalvy, delivering his first budget, holding two important roles, both as the Treasury Board President as well as the Finance Minister and a new Finance Minister. And I think you got to see what we all see around the Cabinet table is a gentleman, and how we approach the budget, not just in the content of the speech that was before him, but the content of his character when he acknowledged the strong leadership of our Leader of the Official Opposition, Andrea Horwath. And I think that's a testament to the work that he has put in and the type of document that he has given the people of Ontario. As he mentioned, we cannot have a strong and healthy economy without a strong and healthy population, and that is why we're so focused on doing a couple of things with this government and this document. First is in making sure that we have healthcare capacity to inoculate those who require inoculation, to provide support for those who have been ill, and to make sure we make critical investments like we have here today, as well as to the Children's Hospital of Eastern Ontario. With respect to the economy, many of the people that would rely on this facility here today and the services that are provided would often work in the sectors that I represent, in hospitality, in accommodations, in travel, and all of those types of areas that are precarious at the moment. And that's why it's important for us to continue to make healthcare investments so that when it's appropriate to do so, and we have inoculated enough people, that we can start to slowly and gradually get our economy moving again. I often say that my sectors, which are responsible for a spectacular double bottom line, one is the cultural fabric of the province, but secondly, a $76 billion suite of sectors, had a triple threat when this pandemic came along. First and foremost, we are talking obviously today about the healthcare crisis, but soon to follow was the economic and social crisis. And Cam touched on the need for mental health services that has increased as a result of a number of lockdowns. And so in order to get the economy back on track, it's investments like this that are so important so that those hardest hit sectors can get back up and running and be more robust and reemerge stronger post-pandemic. And I'll conclude with this, and I think it's worth noting. This pandemic has lasted longer and has cut deeper than any other crisis in the history of Ontario. And that includes the global economic crisis, the SARS crisis as well as the 9/11 crisis all rolled into one. It's lasted deeper and longer than all of those combined. And I think it's important, as we recognize that context, that we continue to say thank you to those frontline workers who have been there, whether it is in our hospitals, whether it is in our community health centres like here, or whether it is our truckers and our couriers and those that are working in our grocery stores. We have been into this over a year now, and I know our numbers in Ottawa have been going up. We're firmly in the red, but we must remain vigilant in order to see a summer where I hope that we're going to be able to reconnect with one another again. And with that, I'm just going to call on my colleague, Jeremy Roberts, the Parliamentary Assistant to the Minister of Children, Community and Social Services, and the host MPP here to say a few concluding remarks before Minister Bethlenfalvy and Minister Fullerton take some questions. Thank you.
Well, good morning, everyone, and welcome to Ottawa West Nepean. It's a bit of a rainy day here today, but we're here to share some truly tremendous news, both for Ottawa West Nepean and for the City of Ottawa as a whole. I'd like to start by thanking Cam MacLeod, the Executive Director here at the Carlington Health Centre, for welcoming us this morning. And Cam really is a visionary, and I'm going to speak about that in a moment. But of course, also want to thank all of my MPP colleagues and who are here today. Minister MacLeod, who of course is dealing with one of the most challenging files during this pandemic, helping the hard-hit tourism and culture sector get through this pandemic. And I know that Minister MacLeod is relentless in her advocacy for that sector and making sure it can emerge even stronger once we're through this pandemic. Of course, my colleague to the west, Minister Fullerton, who again, a tremendously difficult portfolio to navigate, our long-term care file, and making sure that we are getting beds built and making sure that our long-term care residents are protected. And of course, Minister Fullerton was recently able to announce some very good news for Ottawa West Nepean. We are getting almost 400 new long-term care beds here in Ottawa West Nepean, which is going to be a real game changer here in our riding. And of course, our very special guest here today, the Minister of Finance and President of the Treasury Board, my friend Minister Peter Bethlenfalvy, is here with us today. And Minister Bethlenfalvy was last here in Ottawa West Nepean just over a year ago. It was actually the day before the pandemic began. And at the time, he was our tireless President of the Treasury Board. And I don't think any of us really knew what was coming in terms of the significant challenges that COVID-19 would present us. But over the course of the pandemic, in his role as President of the Treasury Board and then as Minister of Finance, Minister Bethlenfalvy has risen to the challenge and made sure that we are spending the investments, making the investments where it is needed most for the people of Ontario and for the people here in Ottawa. This week, Minister Bethlenfalvy presented his 2021 budget, and this budget was centered on two key priorities: protecting our economy and protecting our healthcare system. And of course, as Minister Bethlenfalvy rightly noted in his budget speech, we can't have a strong economy without a strong healthcare system, without a healthy people. And that's what we're here to celebrate today, some of those investments in healthcare right here in Ottawa. Our budget, of course, included significant investments in all of our hospitals right across the City of Ottawa to ensure that they have the capacity to meet the challenges ahead. But we also have some really special announcements, and I'd like to start with one of those. During the budget consultation process, I had the chance to meet with Minister Bethlenfalvy several times to talk about a project truly important to me, which is CHEO's new One Door for Care unit, a project that will bring together a number of special needs, developmental services, and rehabilitation care that are spread out across Ottawa and bring them together on the CHEO campus in a brand new hub. And Minister Bethlenfalvy is not only extremely well briefed in the financial matters of this province, but he also has a tremendous, tremendous heart. And in painting that picture of what CHEO's One Door for Care would mean for our community in Ottawa, for CHEO and for the 40,000 families that rely on it, Minister Bethlenfalvy saw that vision, and this week in our budget, we fully funded the CHEO One Door for Care project, which is tremendous, tremendous news for the people across Ottawa. And lastly, we come to where we are today at the Carlington Health Centre. And I mentioned earlier that Cam MacLeod is a visionary. And when I came here to the Carlington Health Centre shortly after I was elected back in 2018, Minister MacLeod and I joined Cam to open the facility that we're standing in, the top floors, which was a multi-use seniors complex that was going to be networked in to this health centre. And Cam walked us through the upstairs floor, showed us the room, showed us how this was going to make life easier for some of our low-income, vulnerable seniors. And then he took the time to walk us through this bottom floor, which was gravel at the time, and painted a picture, a vision of what this could be for our community. And it is so tremendously exciting to be here today and to see what that vision has evolved into now that this community health center has come together. There's still more work to be done. The building next door, the school building that is the original Carlington Health Center, is still undergoing renovations, and I look forward to coming back with Cam and perhaps some of my other colleagues to see that building come together into what it is going to be. But again, the vision here at Carlington Community Health Center is meeting the needs of our vulnerable populations here in Ottawa West Nepean, and doing a tremendous job. And so I would just like to conclude by thanking each and every one of the staff here at the Carlington Community Health Centre for all the work that they have been doing throughout the pandemic to respond to this crisis. We couldn't do it without you, and we're so glad that we can be here today as representatives of Premier Ford's Ontario government to make investments to support our healthcare system here in Ottawa. Thank you, everyone.
Great, thank you. Now we'll go to the phone line for a couple of questions. One question, one follow-up.
First question from Sean Shepard at the Canadian Press. Please go ahead.
Good morning, everyone. This is a question for Minister Fullerton. Minister, we're seeing reports of vaccine hesitancy levels in long-term care that are concerning. It would seem that, at least according to Ontario's science table, that only about 74% of workers in long-term care homes in the province have received the vaccination. Many are opting out, it would suggest. And I'm wondering what the government is doing to try to ease that vaccine hesitancy amongst those workers so that residents and frankly, their coworkers in these homes can be protected from COVID-19.
Yeah, thank you, Sean. A really important question, and just if I can take a moment to emphasize the importance of vaccinations. They are the best way to ensure your own health, to protect yourself, your family, your co-workers, your loved ones, your neighborhood. They are safe. Millions and millions of vaccines have rolled out across the world. They are well studied and very efficacious. So I just would encourage everyone to get the vaccine when it's your turn. And certainly the staff in long-term care were really the first group to be prioritized for the vaccines that were running out of the hospitals when we first got them because of the requirement of Pfizer to have that very, very low temperature for preservation. And since that time, it has been moved into the long-term care homes through our medical officers of health and the public health units, who have done an amazing job getting the vaccine out. And so I think if you're first in line, I can understand people wanting to have a little more time to watch and wait around the world and see what's happening for their own sense of comfort and their own peace of mind. But it's very clear now that the vaccines are extremely safe, and our public health units are continuing to loop back to the long-term care homes to make sure that the staff have that opportunity to be vaccinated, since if they've changed their mind about it, as well as to pick up potentially new staff that's coming in as well. And each health unit and the long-term care homes have toolkits that they can use to really communicate with their staff. So there's a combination of partners working to make sure as many vaccines as possible are there for the staff and to encourage them to have that uptake. So we'll continue with this. We know how important it is, but I'm very grateful to say almost all residents in long-term care who wanted the vaccine have received it. So this is also very positive. Thank you.
Follow-up, Sean?
Minister, I know it's a very thorny issue, and staffing in long-term care is a huge problem right now, but has the government considered mandatory vaccination as a term of employment for workers in long-term care?
So thank you. First of all, we've hired almost, over 8,600 staff into long-term care with the pandemic pay. And certainly we have the rapid tracking, the accelerated PSW training programs through the 24 colleges across Ontario. And some of them are already in the pipeline, and others will be set to graduate in the fall. So we're really stabilizing this sector, and there's almost, if you add the numbers up with that, the 8,600 that we were able to achieve with the pandemic pay and the 8,200 that are in the pipeline, well, actually almost 9,000 in the pipeline considering all the programs. That's 17,000 staff for long-term care that are coming through. So this is very, very positive. When we look at the level of staffing and the issues surrounding the staffing in long-term care, we know that it's not just about the level of pay, it's about making it a better place to work and encouraging them to understand how important long-term care is and how meaningful long-term care is as a place of employment. So we're making long-term care a better place to work and a better place to live, and we'll continue to modernize and repair and rebuild long-term care.
Great. Okay. Thank you, ministers. No more questions.
Okay,
Thank you, everyone.